Hi, my name is Dr. Neeraj Agarwal. I'm a medical oncologist from Huntsman Cancer Institute, University of Utah, where I direct the genitourinary oncology program, and I'm also a professor of medicine. So here I'm going to talk about the phase 3 registration trial known as Titan trial, which was conducted and results were presented in the ASCO 2019 annual meeting. This was a large phase 3 trial of more than 1,000 patients with metastatic castration-sensitive prostate cancer. And I had the privilege of one of the steering committee members or being on the steering committee of this trial, which was published in New England Journal of Medicine a few days ago. So let me talk to you about this clinical trial. This was, as I said, was a trial for newly diagnosed metastatic castration-sensitive prostate cancer who were randomized to receive standard androgen deprivation therapy versus standard androgen deprivation therapy with the new novel androgen receptor inhibitor, a potent one known as Apalutamida. In this study, patients were allowed to have high volume versus low volume disease. They were allowed to have received docetaxel for up to 6 cycles prior to enrollment on this study. The primary endpoint of this study was, there were 2 dual endpoints. We call it dual primary endpoints, which were overall survival and radiographic progression-free survival. Remarkably, this study met both dual primary endpoints at the first interim analysis, which was conducted after 22 months of median follow-up. So the median overall survival was significantly improved with a hazard ratio of 0.67, which translates into 33% reduction in risk of death. The radiographic progression-free survival was also remarkably improved with a hazard ratio of 0.52. Or rather say 0.48 with a 52% reduction in risk of progression or death. So these are really remarkable findings, which we have never seen until now with this class of drug, which is known as androgen receptor inhibitor. This was the first one to report these results. In one trial, you are meeting both overall survival and radiographic progression-free survival. So from the tolerability perspective, the drug was very well tolerated. The quality of life in these patients was maintained and was equally good as of the control arm, despite the fact that progression-free survival and overall survival was remarkably improved. So what we get out of these results? The number one takeaway is now we have a class of drug which is not associated with multiple side effects of chemotherapy, which doesn't require concomitant steroids, which we need for abiraterone therapy, which is another standard of care, and which is fairly well tolerated. So that is the first takeaway I have from this trial. And of course, this is a new class of drug. It's a new drug in the armamentarium in our fight against prostate cancer, which is a great news. With this, I would like to conclude my discussion. Thank you very much.